Again, I'm Debbie Spiliotopoulos, and I work on the Potomac Heritage Trail here at Northern Virginia Regional Commission, along with Jill. And we're thrilled to have you all here and to present on this event, on this report we've been working on. So first, we're going to give a quick overview of the Potomac Heritage National Scenic Trail. For those who may not be as aware of it, or just for a little background. The Potomac Heritage Trail is a 900-mile trail that starts from the Laurel Highlands in western Pennsylvania and goes all the way through the northern neck of Virginia. It's one of the only scenic and historic trails. It was congressionally designated in 1982, and Northern Virginia Regional Commission has been a technical assistant and partner with the National Park Service since I think that time. It's before my time, but the trail in Northern Virginia is 140 miles. And you may have been on it even if you don't know about the Heritage Trail, because it represents a braided network on both sides of the river. The C&O Canal is part of the Heritage Trail. The George Washington Memorial Parkway is part of the trail. The Mount Vernon Trail is part of the trail, as well as segments that are just referred to as the Potomac Heritage Trail. It's managed by local land managers, which include the Park Service, the U.S. Fish and Wildlife Service, private owners such as Mount Vernon and Woodlaw and Pope Leahy, as well as our local partners, our local government partners, and the Northern Virginia Regional Park Authority, NoVA Parks. The segments of the trail, because they're locally managed and owned, offer a variety of recreation and transportation benefits. They are both bicycling, hiking, and equestrian and water trails in different portions of it. And it offers a connectivity both beyond our region and within our region. And the benefits of being part of a national scenic trail includes additional technical assistance, access to grants, national promotion, and nonprofit and continuous alignments. So I hope that gives you all a little bit of background. Before I go on into the benefit study, does anybody have any questions regarding the Potomac Heritage Trail? I want to start, hopefully we have a lot to cover, but I don't want anyone to feel left behind. Jill, is there anything?
Let's see, there are no questions.
Awesome. Okay, you guys are ahead of the game. Okay, so we've worked on a number of different projects and research studies and coordination through the Northern Virginia Regional Commission. And actually Jennifer Wampler, who I saw is on the call, she made the recommendation, which we're thrilled to have worked through, of developing a benefit study to evaluate the both completed sections and the planned and unplanned gaps, the benefits of the Heritage Trail, looking at health, social equity, economic development, and transportation. And unlike many studies, it's rare to find something where we're looking at the health benefits of recreation as opposed to transportation issues and direct economic benefits. Most of the study was released on the 27th last Thursday, and it includes a report of findings, which is a detailed report on the methodologies, an interactive mapping and dashboard, and then handouts, an executive summary, and 3 sheets of infographics with a lot of the findings that we'll share today. And in addition to the work that BBC has done, we also we had amazing, generous partnerships, both with Virginia Department of Transportation and especially with Virginia Department of Health, who offered Equitable Cities, their consultant, to provide focus groups as part of our equity analysis. And we really appreciate that. And all these materials are in the findings report and on our website, which Jill will share. So here's the big news. We're gonna have a headline. Go ahead, Jill, we can do the next. Just some caveats about this. What we're looking at is only it's only a 1.5 mile segment of kind of surrounding the trail. So we're not looking at overall benefits. We're just looking at the trail's benefits. Also, we're working with 2018 data, and much of this data represents before the pandemic, which, as many of you know, greatly increased the usage and demand for recreation in our region. So these numbers are extremely conservative. And the third element I wanted to let you know is if you look up on that corner map, you'll see that the trail we do not address the gaps that are unplanned for at this point, but of the corridor that goes up to Harper's Ferry and Western Loudoun. But overall, the existing trail that's on the ground benefits the region annually with $494 million. And that's broken out by $404 million in economic benefits, $86 million in direct economic impacts, and $4 million in avoided transportation costs. And it's exciting that these numbers represent pre-pandemic elements. So if we want to move ahead. Oh, I guess actually, Kevin, if you're on the line, would you like to give some insights now? Since I know that you can't stay the whole time, I have to find you. There you are.
Hi, Debbie.
Hi.
No, I mean, I think you covered the general benefits quite well. I think one of the things that we tried to err on the side of undercounting benefits. And I think that one of the things that we consistently find when we study trails like these is that there are a substantial amount of benefit. And one of the things that I think you're going to get into in a little bit, but just a little bit of a kind of a preview, is that this is one of the few studies that's really taken a substantial amount of effort to understand whether or not those benefits are equitably distributed among all residents in the community. I think that that's a really important kind of next step for trails and this kind of work to take.
Thank you. And we'll please pop in if you have other comments or opportunities, and Jill can call on you as well. I know you don't have a lot of time. So jumping into the health overview, this $404 million. Jill, do you want to advance? There were two elements that we looked at, and Jill's going to go into a lot more of the details about the data sources and the methodologies, and there's way more in the report and on our dashboard. But the two components that we looked at were mortality and morbidity. And we used, for all of these studies, kind of nationally recognized methodologies. So for mortality, we were looking at the economic and lives saved for the reduction in death due to physical activity by the residents. And this is measured by a World Health Organization tool, the HEAT model. The morbidity analysis was the economic impacts of avoiding healthcare costs from due to chronic diseases from reduced physical activity. And that's measured using, I think, the American Heart Association model. Okay, you want to go ahead, Jill? So the study found that 13.6 million, and these are all annual costs. Everything that we're showing is annual costs. I wanted to stress that it's not a one-time benefit. But the average, there are 13.6 million miles of walked on the trails annually, and 45 million miles biked on the trails annually, which is approximately 100,000 times a year that each mile is walked, and 300,000 times a year that each mile of trail is biked on average. And 70% of the users are regional who are walking, and 67% of the users are regional bicyclists. And this modeling used a number of different resources that Jill will get into in more detail. Now, this usage reflects 13 deaths prevented and $139 million, and 19 deaths prevented from bicycling, or $210 million. So that's where the $349 million come from. The avoided healthcare costs are 2.7 million walking trips lasting at least 30 minutes. And that is the 23 million, and then 3.8 million bicycling trips lasting 30 minutes, which is 55 million. So that's just some of our kind of the highlights from the, and then Jill is going to get into kind of more of the details about data sources.
Okay, everyone, just before I get into it, just for clarification, there were questions on what this study's numbers are conveying, the fact that it's not the Western Pennsylvania to Northern Neck area of Virginia that these numbers reflect. These numbers are specifically Northern Virginia numbers for the Potomac Heritage Trail. So just wanted to clarify that.
And there were actually a couple of other questions in here too, I just see. One is that the avoided healthcare transportation costs. I think Jill will get into that in a moment. And then the study looked at the full, and yes, it does not include Leesburg to Harper's Ferry, but that's, yes, for a 1.5 mile buffer on either side.
Okay, so I'll go into some of the methodology and data sources. So the trail usage numbers that you just saw, those came from various sources. First of all, NVRC, for those of you who don't know, is a government agency. It's a regional government. And as a government agency, NVRC has access to special databases and tools such as Streetlight and Strava. Virginia Department of Transportation provides NVRC with access to Streetlight. So that was a major data source that we used for this study for the trail usage. And it was also Strava data that was also a major data source for this study. And Strava was used for the northern and southern portions of the region for trail usage. And then for the central portion of our region, Streetlight data was used. Streetlight data uses cell phone GPS data to provide trail use data for both walkers and bikers. It also provides demographics of trail users and trip characteristics like origin and destination. It provides usage data in the form of indexes rather than counts. So to convert the indexes to trail usage counts, local trail counters for various locations along the Potomac Heritage Trail were necessary. And Arlington and Alexandria, they maintain a number of counters along the trail for their jurisdictions. And so that data from those counters in their jurisdictions were shared with us and used in this study. Prince William County also has a few counters that they maintain along the Potomac Heritage Trail, but those were not used in the study because they do not separate out bikers and walkers in their data. So the counter data that we used from Streetlight that was used to statistically calibrate the Streetlight indexes to determine usage counts for the central portion of the trails. So in other words, the indexes, like a 1 would be a low and say a 10 is a high. Those 1 to 10 indexes were converted to counter actual counts using actual physical counter data that are on the trail. So that's how Streetlight was used. And then for the northern and southern portions of the trail that did not have counter data, we used Strava. And because we did not have counters, it was not as good an estimate as Streetlight data would provide, but it was still very accurate, but it was much more conservative for the northern and southern areas because Strava uses cell phone GPS data, but only for those cell phone users that have the Strava app downloaded on their phones. And so that tends to skew the data towards higher income folks. And and therefore likely represents a conservative estimate of the trail. So our numbers, just keep that in mind, are likely very conservative. And when it comes to assessing the economic benefits that you just saw Debbie present, the HEAT model was one of the tools that was used. The World Health Organization HEAT Health Economic Assessment tool, known as HEAT, was used to determine the deaths prevented and the health economic benefit amounts from lives saved. The inputs to the HEAT model included the annual distance biked and walked on the trail using the Strava and streetlight data. It also used death rate data from NIH and economic value of life data from the US Department of Transportation. So with all those inputs, we were able to estimate how many deaths were prevented and the economic outcome. In terms of avoided healthcare costs, the following is a representation of the model that was used. The trail usage data for trips that were longer than 30 minutes was the first input into the healthcare cost model. And the Journal of American Heart Association's estimates of avoided healthcare costs per person were utilized, and those were inflation adjusted to present day dollars, but also to adjust for the differences between national healthcare costs versus Virginia's healthcare costs. So all of these model inputs were used to calculate the Potomac Heritage Trail's Northern Virginia economic benefit from the avoided healthcare costs. And now we'll go into the economic benefits. The economic benefits were devised by analyzing those businesses that were within 1.5 miles of the trail. They were limited to those restaurants and retail establishments that were related to outdoor activities. So overall, there were 254 trail-facing businesses within 1.5 miles that were retail and restaurants, and that generated a revenue of $86.8 million annually. And broken down, it's $3.8 million for outdoor retail and $83 million for restaurants. And this next data slide shows you the out-of-region tourists and what they generate for our region. There are approximately 1.4 million annual trips by tourists in our region on the trail. And on the trail, there's approximately 7.5 million annual miles walked and biked by the tourists. Tourists are generating approximately $331 in expenditures per trip to our region, including $36 in the local tax receipts. So they have a great economic benefit for sure for our region. So we want to keep bringing the visitors and attracting them to our region for sure. And one of the ways to do that is through the Heritage Trail, which is one of many amenities that tourists come for in this region. And just, I forgot to mention that tourists, we are defining those as users of the trail that do not live in DC, Virginia, or Maryland. And one more thing to note on the tourists is that tourists comprise approximately 12% of the miles biked on the trail and 15% of the miles walked on the trail. So that gives you some perspective of what the tourists contribute to the trail versus the local residents. Here you're seeing the transportation benefits of the study. And what we found from the analysis is that commuters, they have about 1.9 million miles of walking that they contribute annually out of all the walkers on the trail. And for biking, there's approximately 4.6 million miles of biking annually from the commuting. And there's 45,000 miles of commuting each year per average mile of trail in Northern Virginia. So it's got a great use, not only for recreation, but also for commuting. The avoided transportation costs were approximately 3.7 million for personal vehicle costs avoided. And then for environmental cost avoided, it was approximately 480,000. In addition to economic benefits, there's also the environmental pollution benefits, where we reduce the environmental pollution significantly by getting people out of their vehicles and biking and walking to work instead. So, oops, sorry about that. Okay, so to get those transportation benefits results, the following model is the model that was used. Streetlight and Strava were used to determine the proportion of trips used to commute versus use the trail for recreation. Streetlight and Strava were also used to determine the number of trips and miles commuted. Streetlight provides a conservative estimate of the commuting trips, so that's important to keep in mind that these numbers are very conservative. And details on why it's conservative are found in the report, but we won't get into that. But if you want more detail, you can look at the report for that information. The cost of environmental externalities per mile of automobile travel were obtained from the Transportation Research Board Journal, and personal vehicle ownership costs were also utilized. These costs were inflation adjusted to the present day value. And all of these inputs together led to our, as inputs to the model, led to the outputs of 1.2 million in savings for the walkers and 2.9 million in savings for the bikers. So next we'll go on to the social equity portion of our project and the study that we're talking about here. So for the social equity analysis, that's important to analyze because you want to know who benefits from the trail. You also want to know who doesn't benefit from it because we want to serve all populations. So in the social equity analysis, we analyzed the demographics of trail users. We looked at the social equity of trail completion and what benefits that would have from an equity perspective. We looked at trail access, traffic crashes, as well as qualitative analyses. So to go into the social equity analysis, we have a lot of extensive data that came out of it. So rather than put it in the presentation, we'll just go to our dashboard and I'll give you an overview of the dashboard. And then I will also show you the results of the social equity analysis for the quantitative portion. So what you're looking at here is our equity and economic study website and the documents.
We're not seeing it, Jill.
Yes.
We're not seeing it yet. We still see
You're
the
not seeing
website. Yes.
Okay.
Maybe
Let me
stop
sharing
sharing.
Yes, thank you. Let's see if this works. Okay. Okay, are you seeing it now?
Yes.
Okay, thank you, and sorry about that. Okay, so what you're seeing here is our equity and economic study on the NVRC website. And under the documents section is where you will find the report. You will also find the interactive dashboard that we are about to look at, as well as all the outreach materials. So our dashboard summarizes all the results of the report all in one place and by topic, so you can quickly find the information you may be seeking. And we will specifically look at the social equity aspect of our dashboard. So in here, we have a lot of interactive maps where you can get detailed information on the specifics of the data, the larger data numbers that you were seeing. Like if you'd want to know, like, for instance, the social vulnerability, you've got those maps here, and you can zoom into the different areas and find out more about what is the social vulnerability of that area. And you've got the legends, you've got all this interactive information that you can go into to find out more details about specific areas of the trail that you may be interested in, as well as to know, like, specifically what was the background data that contributed to the overall results. So what you're looking at here is the social vulnerability index, which was a major input into our social equity analysis. Social Vulnerability Index is a Center for Disease Control data piece that looks at the socioeconomic status, household composition and disability, minority status and language, as well as housing type and transportation, to provide an index at the census tract level for every area in the country. And then we get into the equity findings from the use of this Social Vulnerability Index. The study showed that the demographics of the trail users varied across for the region. For instance, Hispanics, you'll see here, comprise 18.8% of our region. However, the existing walk-in users of the trail are only 11.8% Hispanic, which is a lot lower than their regional concentration. And for bikers, it's much less as well. And you have that for other race groups and ethnicity. Well, the Hispanics is the only ethnicity, but you have that case for other races as well, which are shown in red, the ones that are lower than their overall population. But our goal as for the National Park Service, as well as all the local managers and everybody involved in managing this trail, is to ultimately have an equitable trail that serves all populations. So for trail completion, which is shown on this map, where you've got like the purple areas that are planned trail segments in various areas, you can zoom in and get more details on that, on where the trail needs to be completed and is not right now, such as the Goose Creek area right here and Broad Run area of Loudoun County, which was a special study area we did. Then you have areas that have no planned routes right now, such as this area between Great Falls Park and near the Beltway, Scotts Run Park of Fairfax. So you can go through this map and see what's the social vulnerability of each of these areas where there's no completed trail. And it did show from this study that overall for the region, the trail areas that were not completed are areas that are more vulnerable in population, such as the high vulnerability area that you see here in the dark blue. And next is the trail access that was analyzed. We also saw a pattern here where the proportion of census tracts that had access currently to the trail is lower. So for high socially vulnerable areas, 11% of the census tracts that were highly vulnerable, for instance, did not have, only 11% had access to the trail through trail access points such as parking lots. And then we also analyzed bus station and rail station access to see were there vulnerable areas that were not served via bus stations and rail stations that we would like to provide access to in the future. And from this, we saw that tracks with bus access was pretty much consistent across all indexes from low to high. And tracks without bus access, the second column here, was approximately in the 70% range for all of the index levels. And tracks with rail access was low, below 10% for every index, but it was very low for the moderate and high socially vulnerable areas. And traffic crashes is a barrier to trail access, which Debbie will get into more details about the aspects of safety and what we should consider as planners in the future for improving safety around trails. What we noticed around the Potomac Heritage Trail in Northern Virginia is that the proportion of tracks that had fatal crashes, which are the areas that are marked in red, which you can again zoom into and get more details on those areas. Those socially vulnerable areas had the highest proportion of fatal crashes. And those tracks without fatal crashes were the lower vulnerable areas. And so that was our social vulnerability analysis. And then the qualitative analysis, Debbie will go into, but again, all of the different components of the study you can find in this dashboard. So we'll now go back to the presentation. And let's see if I can, we'll have to stop sharing and then get the presentation again. Let's see. So I believe, okay, so you should see it again.
Jill, we had some questions as well. Can we?
Okay, yeah, before we
ask
turn it
them?
over to Debbie on the qualitative side, certainly I can take questions,
Okay.
and Kevin can as well.
Yep. We had a few questions. One was about the population who travel, with the GPS tracking, which Kevin answered in the chat regarding, higher incomes. And Kevin responded that adults with smartphone in the US are about 85%, and Streetlight tracks cell phone data. And I believe that that was something that is not as much of an issue with Streetlight as it is with Strava. And then Millicent Miller from Department of Health had asked about lost productivity with the morbidity analysis, which was not included. We just did the morbidity analysis. Thank you, Kevin. And then Chris had asked, where did we get our demographic data for the trail users? So do you want to answer that, Jill?
The demographic for trail users came from Strava as well as Streetlight. Both of those data sources provide information on the trail users.
And Kevin also in the chat, thank you, Kevin, you're really on top of it, responded with some good information on cell usage. And then Champ, you had raised your hand. Do you want to unmute and ask your question?
Pressed by accident, never mind, sorry.
Oh, okay. Great. And I put in the chat, I think everybody saw, I put in the chat the link that's on this slide so that you can access our website and all the materials that we're discussing. So now getting back into the presentation. We have a good question. Chris, do you want to ask your question?
Sorry.
Chris Slatt?
Sure, I can do that.
Okay.
My question is, so the rebuild of the American Legion Bridge is expected to add a trail connection across the river. It seems like kind of a big opportunity to connect this trail in the Virginia side to the C&O Canal towpath in Maryland. I was just wondering how would you expect a connection like that to affect the economic impact of the trail? Because it's my understanding that National Park Service has requested that that connection not actually be made to the Potomac Heritage Trail in Virginia.
Well, we can answer in some of the case studies, at least what we found with connections and what their impacts were to the overall section, the overall usage. So hopefully that would be somewhat helpful. I know that that's a big challenge right now is that alignment. Jill, do you want to put the PowerPoint back up?
Yeah, I'm sorry, having technical difficulties trying to get it to go back up. So why don't you take a few more questions till I determine what's going on.
I think we have folks from NPS on the line as well. Or Kevin, do you want to give some feedback on your responses on some of the questions? Are you still there?
Yeah, I am. So, the streetlight data is really interesting. I mean, I think that it's the best data that we have available. At the same time, it's not perfect in terms of having a survey, a survey with all of the users that are on the trail and understanding their demographics. I think somebody just messaged me saying that, because the cell phone data is somewhat anonymized, there's some interpolation of demographic information based on neighborhoods and travel patterns and those sorts of things. So I think that, as and quite frankly, the streetlight stuff is a little bit, it's great data, but it also like underscores sort of the cell phones are tracking us everywhere. But I do think that it provides some really good information. I think when you're looking at connections, one of the things, like the potential for the American Legion Bridge, obviously increasing the connectivity and the ability of those two networks, on either side of the river to be traversed by, walkers and cyclists, and will kind of further that economic benefit. But I know that, there's a lot of complex considerations that go into, a bridge like that. So it's not just about sort of economic and health benefits of the biking and walking.
Great, thank you. So we have and I think that the Neabsco Creek study is a good example of just the kind of the ripple effects of benefits that come from these studies, once a trail is built. So I'm going to go into the kind of the more qualitative elements. We had two different parts of the study. One was focus groups that were generously offered by Virginia Department of Health and run by the Equitable Cities. And the second was a series of business interviews that were conducted by BBC, by Kevin and his staff. The qualitative analysis were really, the focus groups were added to the study as a recommendation and offered 4 groups with half their participants identified as minority. And they were conducted virtually in September 2021. And we had 10 residents that were interviewed in greater depth. The business interviews were with 8 community members of both non-governmental and governmental representatives, and that focused on the barriers of trail access and also underserved populations and recommendations and strategies for future engagement and programming. The focus groups results, you want to switch, Jill, next one, were the residents were really about making the trail more comfortable and accessible. The residents found the Potomac Heritage Trail a safe and ideal place to interact with nature and to exercise. But there's a need for improved marketing and advertising on the trail, both in terms of wayfinding and just general awareness. There was also a need for greater amenities of both parking, restrooms, and benches so that all abilities will feel comfortable making use of the trail in all ages. While most participants felt safe on the trail, some noted that they avoid using the trail at night and they feel more comfortable in groups using the trail. And they recommended that local agencies and groups offer programming to make people more comfortable, especially those who may be less comfortable on the Heritage Trail. And minority residents said they felt more comfortable on the trail when they see people like themselves making use of the trail. The in-depth business interviews resulted in recommendations related to designing the spaces with greater lighting, sightline and more comfortable amenities, more programming with the community to activate the trail and understand the balance between recreation and transportation, and to offer greater communication so that residents understand that the trail is for everyone, but also that it's an available resource. And finally, there was a recommendation for enforcement and local government to understand the unique needs of the different communities that could be using the trail. And then in summary of the social equity analysis, one thing is that there are fewer trail access points for vulnerable communities, and that there are more trail gaps and unplanned route segments for vulnerable communities, and that and they also experience, the socially vulnerable communities also experience a higher number of pedestrian and cyclist crashes with less access to transit. One thing I would like to point out is that when we think about the transportation and the crash reduction safety issues, we don't think about the broader ramifications of people not feeling safe on the road to be able to access resources like the recreation, the parks and the trails in our region. So this is something that might add hopefully the fact that we're looking at the quantitative hard numbers of benefits from the Heritage Trail, that there's also an additional benefit that could maybe spur more transportation dollars, in that there's a ripple effect for all the community, even those not commuting, but are just walking, feeling more comfortable to walk and move in their neighborhoods without the risk of crashes. We had the two community feedback mechanisms, and then the main message of the community was improving accessibility and creating more welcoming environment for all users and all abilities. So a number of these elements are much less expensive than full trail completion. So that's a real good news story in terms of things we can do right away to improve the trail and its accessibility. So the next portion of the discussion is we're going to share is about completing the trail. So there were three things we did. One was, well, two things we did. One is this overall looking at the gaps. And the second was looking at the two specific case studies. So in looking at the overall gaps, the evaluation, similar to what we did, was an overall benefit of $80 million in annual mortality benefits and $13 million in avoided healthcare costs if all the planned and unrouted gaps were completed. The planned routes are about 21 miles and the unrouted gaps are about 13.7 miles. And this would generate 1.3 million in additional walking for the planned routes, 4.5 million for additional miles biked, or 900,000 additional miles walked, and 2.9 million additional miles biked for the unrouted gaps. So going deeper, completing the trail, we also looked at two case studies. One is a completed section, which is the Neabsco Creek Boardwalk, which is a beautiful pedestrian-only boardwalk in the Prince William area of our region. And the second is the signature study from the recent Loudoun County Trails plan, which is a connection between Broad Run and Goose Creek alignments. And it's also known as the signature project that would connect the Potomac Heritage Trail with the WNOD Trail. So the Neabsco Creek Boardwalk, which is, it's nice because it's a way to look at like what our estimates are versus the actual. It's pedestrian only. It was opened in 2019, and the estimate would be approximately 100,000 miles walked from our study. However, 250,000 miles were walked in the 2020, 2.5 times the regional Heritage Trail average per mile. It generated a higher resident use of the trail overall in the entire system, and also increased the usage of other parks and trails in that area, in the surrounding parks and trails in the area. And it represents an approximately 2% increase in Heritage Trail use by pedestrians overall, and of $1.5 million in additional avoided healthcare costs using our model. The second is the planned segment. So of course, this is going to be a little more conservative because we don't have the actual numbers. But this is a walking and biking infrastructure project. And Loudoun County has a planned trail improvement of 6 miles, connecting the Potomac River to the corridor to the WNOD Trail. And a lot of the Potomac River corridor in this portion of Loudoun is more pedestrian and versus other sections. So based on this analysis, it may add 100,000, our 2018 number conservative analysis, we're looking at 100,000 miles walked and 300,000 to 1 million miles additionally biked, representing a 0.7% increase in walking and 0.4% increase in cycling. And 600 thousand in walking and avoided health care costs annually, and 300 to 500,000 in biking and avoided health care costs. So as we draw to a close, the overall summary of the benefits that we found from the study are 350 million in health benefits of the current alignment, 45 million in avoided healthcare costs, unequal access, and the need for some more tailored programming and investment for social equity, and substantial business activity along the trail with opportunities for increased tourism, and $86 million in economic benefits annually in direct economic benefits, and then 4 million in transportation's in annual savings, and trail commuters that are reducing pollution. Completing the gaps will improve the impacts of all these areas of analysis, and the annual benefits of trail completion is estimated to be $101 million annually. Some short-term recommended actions in addition to the construction elements of completing the trail include design, creating spaces with better lighting, sight lines, and amenities, programming, working with community organizations to encourage trail use by all our populations, better communication, including wayfinding and signage, as well as making the trail more welcoming to all users, education on the unique needs of the community, different communities, and improving pedestrian and cycling access and safety to the adjacent networks so that people can get onto the trail, and then a need for greater data collection so we can confirm and understand who's using the trail and how it's being used, and then greater outreach. So what we're doing here at NVRC is our next activity is to update our corridor analysis for the Potomac Heritage Trail, where we're looking at gap planning, wayfinding and amenities, where we're going to work with our individual landholders to see kind of what is where and what's needed, communications and outreach efforts the different groups are doing, and then to provide continued technical assistance for trail partners. So that's everything that we have. Jill, do you want to, or do we have questions?
Yes, so we will stop sharing and we'll just go into questions now. So let's see. And Kevin, thank you for answering several of the questions that were on the chat. So let's see. We have a question. Can cyclists walk their bikes across the Neabsco boardwalk? Can you answer that, Debbie?
I'm sorry, can you say that again? I'm sorry.
Can cyclists walk their bikes across the Neabsco boardwalk?
I do not know. Is anybody from Prince William County on this call that can answer that? I believe that, I don't know. Charlie, are you on the call?
I'm sorry, we got an answer in the chat from Ann O'Neill from the National Park Service, and she says she thinks so. That's not a definite, but we think so. But
this is David Brickley. Yes, you can.
you can?
Thank you,
Okay.
David.
You're welcome. It's a great trail, great boardwalk.
Yeah, David was the instigator. He's been the instigator of some amazing trail segments throughout the corridor.
Thank you.
I also had another question that Kevin provided an answer to, and that was, did the study look at the average length of a trip taken by bike or the average length of a walking trip? And Kevin's answer was, yes, we did, although I don't have those numbers at the tips of my fingers right now. And they were not put in the report as well. So certainly if you follow up with us, we can forward the question on to Kevin and get an answer for you. And does anyone else have questions? And you can just you can unmute yourself and ask questions. We have 5 minutes.
Okay, we got crickets. One thing I did want to just bring up is that our past superintendent was Don Briggs, and he was involved in the Woodrow Wilson crossing for the Heritage Trail to National Harbor. I don't know if any of you in this region have used that. So one of the things I know is really helpful about having a braided network is the opportunity for lots of loops and connections, both to schools and communities and between different trail systems, which is what's so exciting about the Loudon Signature Project.
We do have a couple more questions. One is, are there any segments other than the Neabsco Boardwalk that are single mode, which would mean bike only or pedestrian only? And are there any plans to provide alternative routes for modes that can't access those segments, even if just by wayfinding? So yes, a large part of the Potomac Heritage Trail, especially through Fairfax County and Loudoun County, a large part of that is mostly pedestrian only. And through Arlington and Alexandria, there's a great amount of biking opportunity there currently. And in Prince William County, I believe that is mostly pedestrian, but there also is biking opportunity down there. And to answer the second part of your question, are there plans to provide alternative routes for wayfinding? That is currently not something we have considered, but we take suggestions like that and certainly will act upon it. So thank you for that suggestion. We will definitely look into that as we're doing our 2022 corridor analysis and the wayfinding aspect.
And I wanted to
Let's see, another question was, how hard would it be to translate this methodology to another region? So to do so will be challenging unless you have counter data in place. So counter data was extremely critical to being able to do this study. Without it, we would have had to resort mainly to Strava data, which is accurate, but not as great a resource as Streetlight, where Streetlight covers all demographics. You don't have to rely just on app users to obtain that data. It's pretty much anybody with a cell phone, whether they have, if they're using a cell phone on the trail, they will have their GPS coordinates sent to Streetlight's information system. So Streetlight is much more extensive, but to use it, you need counter data. So your first step, if you don't have counter data, would be to get that. And once you have that, it's the method that we use certainly would be transferable to other regions, and we could help you do such a thing. And that's part of this study's benefit is being able to transfer our methods to other regions of Virginia and other localities throughout the country that would want to use it.
And I just wanted to say that we did hear from Jerry DeYoung. Jerry, thank you so much for responding. They confirmed that the connection to the Dupsino Canal will be an alternative analyzed in the EIS for the American Legion crossing. So just a heads up on that.
And the last question we just had was, since most counter data was stated to be Alexandria and Arlington, is this skewed to those areas? The answer is no, it's not skewed to those areas, since the central area of the study was Alexandria, Arlington primarily. And that central area utilized Streetlight, whereas the northern and southern areas use Strava data. But the Strava data is still very accurate very accurate, just it may be a little more conservative than Streetlight. So our baseline of conservative numbers is really our foundation. So you can just think that the numbers are likely much higher than what we showed.
And I just want to thank you, Henry, for noting this, but I just wanted to do a huge shout out for David Patton, who helped us with the counters in Arlington. And one of the things that they did that you'll see is that the counters included walking counters.
Debbie, we can't hear you.
Oh, that's weird.
There,
Can you
we
hear me
hear
now?
you. Yes,
Can you hear me
can you
now?
repeat
Okay.
that, please?
Okay, can you hear me now?
Yes.
Okay, I was just going to say thank you to Henry for letting us have an opportunity to thank David Patton, who provided us with the counters in Arlington. And the counters in Arlington were really important because they offered, as Jill mentioned, pedestrian counts for those elements. And another comment is that another section that's all pedestrian, mostly pedestrian, is the George Washington Memorial Parkway. Most of that segment in the north. Great.
Okay, so we are out of time, but the presentation will be posted on the equity study website that I showed you earlier. So you can find it there. And if there's any questions we did not answer, feel free to email NVRC and Debbie